want to make the entry point. Of course, the product is a resorbable product and therefore highly biocompatible. The treatment can be repeated both to obtain greater fullness and definition and to maintain the result over time. It is absolutely painless and guarantees immediate result, lasting about 12-18 months, as I say. Generally, talking about absolutely painless is not really true. I mean that it depends, as I said, about duration, also about the pain. It depends on your patient. There will be patients that doesn't feel anything, and there will be patients that can feel some discomfort. Of course, it's not really painful, but sometimes some patient could say to you that you are making something that they feel as a discomfort. So the idea is to understand also about the pain of the patient if you are making something wrong or something in the correct way. But later I will show you why. About post-treatment, of course, after treatment, no particular precautions are required, no day of hospitalization, of course, and the patient could return to normal daily activities immediately after the treatment. Of course, could be useful for the best result to avoid something. So, of course, it could be therefore recommended to undergo a short 1-2 days rest cycle, avoiding to use any skin product and especially on the buttocks and surrounding areas. It could be recommended to avoid exposure to the sun or UV lamps for at least 15 days in order to allow proper healing. Avoid important temperature change, such as excessive heat, for example, saunas, Turkish bath, or too cold, and refrain from playing sports and all those activities that can cause excessive stress on treated part or an increase in compression. For example, there are, especially for the sporty people, it would be better to have a rest from the gym and from their normal activity. And of course, periodically perform small adjustment that allow you to prolong the result for a longer time. So you have to explain to your patient that you need to just to control, to see the patient again after the injection. So you can imagine to program some control after 3 months, for example, or 3-4 months, to see your patient, to understand if you can imagine to inject something again, to not repeat the same treatment. We are talking about a product that has inside the same syringe, prefilled syringe, 10 ml product. So we are talking about a product that on body areas need to be injected in a good amount. So generally, we are talking about at least 10 vial, more or less. So when you have, for sure, also for the patient, would be a little bit expensive. So to not repeat the same treatment, you could adjust just for 2-3 months with 2-3 vials that could be shared for both sides, especially for the buttock, for example, to maintain the result during the time. Now we can see some photos of before and after. And later, I will show you a video for how to inject this product, how to perform also the drone to inject in our patient. As you can see, especially for the buttock, you can see the volumizing effect. So in this case, for example, we used 40 ml for gluteus, so 4 vial per gluteus. So we are talking about 8 vial of products. Here the same, 60 ml for gluteus, so 12 vial in total, so 6 vial per side. Here the same, just to change a little bit the shape, not too much to volumize, as you can see. In this case, the same. And here could be something interesting. The photo is not the best quality photo, of course, I'm sorry for that, but you can imagine to treat also other kind of areas, not only for the buttocks, as I said at the beginning, So we can imagine to treat the scars of some patient, imagining to feel them and to, of course, blocking some fibrotic areas and something, but also to feel to restore the shape of the body before the surgical procedures, for example. Here, another patient with 50 ml per side, and another one with 80. So 8 vial per side. We are talking about 16 vial in total. Another with 70 per side. And another one. And again. Generally, when we talk about this kind of procedure, I prefer to use one entry point, if possible, because this could help us to also to perform the product with the less problem about, about, for example, infection, just for infection, but also about the pain of the product or the pain of the procedure generally. When you are speaking about a procedure like that with a patient, you have also to consider that the patient have to have care of the entry points after the injection. So it's better to use one entry point, one access point. Of course, if needed to be injected in multiple areas, of course, you could imagine to practice more than one entry point. But if you can start to imagine your procedures always with one entry point. Of course, going forward with the other presentation about the SKINFILL, here we are talking about another kind of product that is not in pre-filled syringe, but is in a vial. So you can aspire the product due to your idea to fill your patient. In each vial, you can find 50 ml of product, sometimes something more. But we will see just in a few seconds, in a few minutes, what we are talking about. Of course, as I said before, having a perfect body is in everyone's dream. Firm buttock with an harmonious shape, toned arms, and no imperfection. A design that today can also be achieved in a non-invasive way. Of course, you have to imagine that 70% of the patients that need or that want to improve the buttock volume, for example, renounce to the surgery, so 70%, because they have fear about the scars, fear about to have something of foreigner in their body, fear to the pain, for example, or to the downtime. So in this case, you have a great market about that to improve your practice, your clinical practice. So don't be afraid about this kind of procedure, because it's something that could be performed without great problems and with good results, of course. So, as I said, we are talking about also in this case about a cross-linked hyaluronic acid. As I said before, in a monophasic gel, in monophasic hyaluronic acid gel, macromolecular weight, highly cohesive, that could be used for remodeling, to make a filling effect with a slow resorption. Of course, a product that is biointegrable, easy to apply, without side effects. Yes, of course, without side effect by the product. But of course, you have to be careful with the procedure, because some side effect could be performed by your technique. So the technique is important, and with an immediate effect. Of course, as I said, if in one product we can find on the left side of your screen a pre-filled syringe, in the other, it is called the SKINFILL Body Topic, is another product that is in a vial. This is the box. In one box, you can find one vial of product. And we are talking about, of course, products that are designed for body, that are, as I said, monophasic. Why it could be important, the idea to be monophasic? Because a lot of products are biphasic. So we are talking about, generally, when we talk about competitors on market, they are biphasic mixture of hyaluronic acid, of course, consisting of free hyaluronic acid and cross-linked hyaluronic acid. These fillers are the only products, these we are talking, so Perfect Line Body and SKINFILL Body are the only products made entirely, completely cross-linked hyaluronic acid in small agglomerates. Could be interesting for us to imagine that small agglomerates is useful to reduce the reaction of the body, like for example granulomas, like for example great inflammations, and reduce a lot of side effects. But it's important also to imagine that sometimes with the biphasic mixture of hyaluronic acid, you could have different time of reabsorption. So you could have a result that couldn't be always the same during the time. Sometimes could be for a part with a less duration and in another with the longer. But you can understand that this could be a great problem, because when you have, especially for the buttock, a part that could be reabsorbed easily or fastly than another, the patient could observe something that is not uniform, and the patient come back to your clinic to understand why, to reduce the problem, to solve the problem. And so, especially with other products, you will be in a cycle of this kind of problem, because injecting only the area where you have a fast reabsorption, you could start with a product that will have longer duration than the others. So it will be a problem that could present to you more than one time for the same patient, for the same procedure. So this could be a problem. With a completely cross-linked hyaluronic acid, this couldn't appear in theory, but normally it doesn't appear, of course. As I said, we have a product that has not added free hyaluronic acid, highest cross-linking ratio, highest hyaluronic acid concentration, that, as I said, is 20 milligrams per ml, more particle size, that, as I said, could help us to reduce some inflammation reaction mediated by the patient body, highest viscosity, longest duration, and low extruding force. This could be also important because, especially when you use the cannula, you're not so confident with this kind of procedures. For the doctors, of course, could happen some pain of your hands, and especially for us, the hands are really, really important. So it could be important to use the right cannula, but also with the right cannula, of course, you could find some products that are really, really hard to be injected in your patient. With this product, it doesn't happen. As I said, also for this product, we have a macromolecular structure, so high molecular weight structure to guarantee the best filling performance, small particle structure, as I said, for fast and perfect integration, slow and homogeneous resorption. So the macromolecular structure and the highly cross-linking, with highly that is highly cross-linked, reduce the reabsorption, of course, rate and optimize its degradation, making it homogeneous. So the reabsorption, as I say, just or better, not just for that, but especially because the product is monophasic and a product that is really handled and really plastic. So highly manageability, fluidity, and extrusibility make the product unique and easy to implant. About the macromolecular structure, as I said, high molecular weight associated with a high degree of cross-linking, two fundamental characteristics in order to guarantee a very high remodeling power, while maintaining exceptional fluid dynamic characteristics, perfect efficiency, and biocompatibility. Another characteristic that I explained before for perfect line, but is the same for SKINFILL body, is the 3D rounded cross-linker. High degree of cross-linking for exceptional durability, so high cross-linking agents, a three-dimensional reaction technique that improves rheological and durability performance, a specific reaction. The highly concentrated cross-link reaction reduces the lure of water, resulting in an effective and long-lasting filler. Limited water recall, especially with the biphasic products. The water recall at the beginning, especially at the beginning, just after the injection of the product, could be really important. And for some patients, this importance could be like a problem about the pain, about the volumizing effect that is not the real volumizing effect that you can observe. And also for us to understand that if you are performing the good volumizing effect with the product that you are injecting, the limited water recall could be an help to perform a good result, to perform the best result, the best procedure that you can do with the body filler. Of course, especially if you don't use the product only for the button. As I said, slow and homogeneous absorption, because the combination of high molecular weight and a high degree of cross-linking reduce the rate of degradation. So physical-chemical characteristic. Three-dimensional spherical structure, the high concentration cross-link technology further reduce the degradation rate, making it homogeneous over time. And thixotropy, the property of hyaluronic acid of base gel to become more fluid under pressure and to immediately return to the original viscosity within the tissues. This is the vial, as I said, compared to the syringe, to the prefilled syringe. So this is how the vial appear. And about the handling and plasticity, of course, thanks to the thixotropy characteristics, the hyaluronic acid gel is easy to implant, despite its high molecular weight and cross-linking structure. So remember always that the vial is 50 ml of product and syringe is 10 ml of product. Of course, the gel based on biosynthetic hyaluronic acid, of course, 20 milligrams per ml of concentration, so 2%, a pH range that goes from 6.5 to 7, with the BDDE, a cross-linking agent that is the 10% of the product, the final product, with always with the residual BDD that is less than 2 parts per million, with residual protein that are less than 0.1% of the product, and the duration, as I said, that could be up to 18 months. Of course, here you could see that the product in the vial is 50 ml sterile and non-pyrogenic solution, and the product made with syringe, with prefilled syringe, is 10 ml, but with CE mark. This could be one of the differences between the two products. And of course, about indication, as I said, calves, arms, body remodeling, the breast scars, so the same that we said before. Average quantities needed for the treatment of the different area of the body could depends. In general, I don't like to share with you an idea of which amount of product will be used in each area. But imagine that if you want to treat the buttocks, for example, you could start from 50 ml of product. I suggest you something more, but it depends. it for real depends from what the patient want to obtain. But generally, the suggestion is to not use more than 300 ml of product. So 30 vial or six vial or 30 pre-filled syringes. So this could be an idea to differentiate the two products. For the arms, for example, is better to avoid to go up to 50 ml of product. Also because on the arms, sometimes the product will be visible. So start with less product, and after 2 weeks, for example, starting with the controls that you need to imagine to control your patient, you could imagine also to treat again if you want a better result. For the caves, the same, starting from 50, going to 200. And of course, for cellulite scars and holes, you could imagine to start with 10 ml, so with one pre-filled syringe. But I suggest to you to use this product only after another procedure. It's a parasurgical procedure, of course, that could be performed with a needle to cut the fibrotic tissue that is the way, or better, the traction of the fibrotic tissue that can be the cause of the holes and of the cellulite scars. Maybe there is one question. With the hand. Okay, later I will answer to your question from Vietnam. And here you can see the result on another patient with this product. It is more or less, as I said, like the other. There are no big differences between the two products, if not the CE mark. Here another patient. On the left side, in the upper part of the screen, you can see also the drawing that you could perform to understand which area has to be treated. But later I will show you with a video how to perform it. And as you see, in this case, we performed the procedure making 2 entry points. The lateral one used to perform the treatment on the lateral part, and the central one to imagine to perform the treatment in the upper part and the medial one. This case with 40 ml per side. Another patient that of course need to also to improve the skin quality, but with a good volumizing effect on the buttock, in my opinion. Of course, also in this case with 2 entry points. Another one, and another. On the left side, the procedure after the injection, the buttock after the injection. And here the same patient, right gluteus, as you can see. And here, another patient treated with hyaluronic acid for the scars that I said. And this picture is made 1 month after for treatment of, she said, diastasis. Yes, of course, but for a surgical procedure of diastasis. So the patient has a fibrotic retraction of the skin for the fibrotic tissue, and you can imagine to treat this kind of problems also with hyaluronic acid. Another patient using 50 ml per side. Okay. And you can see also the reshaping of the body for the hip dips, for example. And thank you for the attention on these slides. I want to just, before to answer your question, to share with you, if possible, the videos of how to aspire the product, especially for the SKINFILL body, because sometimes it could be difficult to perform this thing from the vial. Generally, I use always the lower slip syringes. The lower slip are not the lower lock, of course, are the syringes that has the part that protrudes part in on top of the syringes. And as you can see, the product has plastic top. You could also remove that and start to aspire the product, going to broke the upper part of the vial, not really to broke, but to reduce the efficacy of the top in neoprene. And the lower slip, as you can see, is this kind of syringe that has the flip, the slip on top of the syringe. This is a 5 ml syringe, but I prefer the 10, just to imagine that you are using. But this is your opinion. I mean, if you are more confident with 5 ml syringes, use the 5 ml syringes. In my opinion, it would be better to use the 10 ml, also to remember how much you injected with one syringe. So it could be better for me to use the 10 ml syringe. But when you have this kind of syringe for this kind of vial, this is the best way to aspire the product. It is really easy to do, as you can see. Just because some colleagues asked to us how to do, because if you use the 18G needle to aspire, it could be really difficult to aspire the entire product just using a needle. Also, if the needle is 18 or 16G. About how to perform the product, we have a video that starts also with the drone. So when you make the drone of the patient, you could imagine to identify the muscle, as you can see that our colleague do that. So they identify the gluteus muscle, and when you has identified it, you have to divide the gluteus in two equal parts, as the colleague is doing. So you can see that the product, that the buttock, the gluteus, is divided in two equal parts, right and left. And after that, you have to divide in three equal parts, starting from the up to down, so to the lower part. This kind of division could help us to identify 4 areas of the injection. So as you can see, the colleagues are drawing the gluteus muscle. So this oval form is the gluteus muscle. Of course, the injection has to be performed up above the muscle, because you don't have to go. Now you can find a lot of colleagues that, or not a lot, but some colleagues that explain you to inject the product under the muscle. This could be extremely painful for your patient and really dangerous for them, also because you are going to inject the product in an area where you can find the arteries of the gluteus muscle. So the best way to perform this treatment is to go above the muscle, under the fat, in the layer that could be identified between the hypodermal tissue and the muscle. When you go there, for the patient could be really less painful, and of course the treatment could be safer, as I say, for sure. So The idea, as I said, to divide the gluteus in two equal parts, left and right. So I mean, for each gluteus, you have to divide one left side and one right side, and you have to divide in three equal parts, starting from the up, going to down. In the lower part of these three, you don't have to inject hyaluronic acid, because the hyaluronic acid could improve the how can I say, the migration, or better, could become a little bit heavy for this area. So you can have an improvement of the weight of this area, and for the patient it couldn't be a good result. So imagine always to remain in the two upper parts of the gluteus, as our colleague is doing. So she's imagining to treat especially the area that she signed with an X, and she's starting from one point that she has measured before to perform the treatment to understand if her cannula could arrive in that area. So imagining, of course, when generally we treated our patient, the treatment is done with a 70G cannula, 10 centimeter. So normally, when you imagine to perform your entry point, you have, as she has done in the video, to understand, as I'm trying uh, to show you how to do, she's imagining to perform the treatment, understanding if the product could be injected starting from that point to the other parts, to all the parts of the gluteus, to the entire part of the gluteus. So try always at the beginning to perform this treatment in this way. So you will be able to understand if the product will be injected in the entire parts of the gluteus. As I said, when you identified the entry point, you start with the injection. In this area, you could imagine to treat the area on the left or on the right side, depending on the patient requests or on the patient necessity. So, as I said, always above the muscle. In this case, for example, sorry, I want to already show you. In this case, the colleague is using a reusable cannula. Generally, when we perform this kind of procedure in my studio, in my clinic, but also in here during the workshops, for example, we use a mono-use cannula. So I suggest to you always to use the mono-use cannula, just for the cleanliness of the product, or better, of the procedure, and to avoid infection or some reaction of the body. That happened to me when I used at the beginning this kind of cannulas. So, as I said, going above the muscle, as you can see, you don't have to see the cannula, but you have to imagine that the product has to be injected above the muscle, as I said. As you can see, the patient doesn't contract the muscle, so it means that she doesn't feel pain during the procedure. And as you can see, the procedure is really fast, no bleeding, and especially easy to be performed. This could be an idea when you use especially perfect line to change your syringe directly to the cannula. When you use another product, this was the result, sorry. When you use the other product, so perfect, the SKINFILL body, I'm saying, this could be better to go out with cannula and to apply the cannula on the syringe just after the aspiration of the product from the vial. And this is finished. I will just to show you if I found it. One thing. Okay, here. And during that, I will answer to the question. So, Johnny from Vietnam said me, with the hand, may we use the SKINFILL body to save cost? With the hand, you mean, sorry, Johnny, you mean for the hands, so to treat the hands? Because I didn't understand. If this the question, I don't suggest to use the product for the area where the skin is really thin. So you couldn't use, you could do whatever you want. But of course, if you want to avoid problems, you could imagine to not use this kind of products, especially because the products are, as I said, micromolecular, on the areas where the skin is really thin. So what does it mean? Especially for the hands, especially for neck, especially for feet, for example, it is the or intimate area, no? Especially for that, you have to avoid to use this kind of product because the skin is really thin and sometimes you could have problems like granulomas, or also if you don't have granulomas, you could imagine that the product would be visible after the injection. Also, if you apply a great massage and something, and the patient wouldn't be happy to have an area of his or her body that could be visible, that was injected, especially for neck, that is a part that is really visible, for the intimate area, for example, or for the hands in this case. So I don't know if it's what. Yes.
Dr. Ruggiero, can I just check? They could use SkinFill Plus for that, right? Because they are also distributor for SkinFill Plus range for the
Uh,
hands. They can
yes.
use the SkinFill Plus filler for the hands.
Yes, this was what I was answering. So I say I don't suggest to use this product for that, just because the hands are an area where the skin is really really thin. So I prefer to use the products made, of course, made for the face, not for the body. This is my opinion, of course, as I said. And as you can imagine, the company doesn't suggest to do this. Of course, you are owner in your clinic, so you could do whatever you want, but it is not suggested, and you can't find this indication on this kind of products. For the both too. So for the perfect line and also for the SKINFILL body. I know that it could be a way to pay less, no, of course, to save costs, but it is not suggested. Are there other questions? I saw that there is a message, but not in English, so I can't understand.
Hi, do we have any other questions for Dr. Ruggiero? You can either type it in or you can ask verbally.
Yes, if they want, they can also text on chat. I'm here for you. So is there someone that already used other kind of body fillers before to have this webinar, for example? Or no one has used other kind of products? Okay, I think that no one used body fillers. Just to understand the difference, for example, no, about how to perform the procedure. if someone says something different. As I say, someone, for example, suggests to use the product in the muscle, but I think it's too dangerous for what we have to do. Sometimes it doesn't, it's like too much for the effect that you can obtain, and too dangerous for what you have to do. I think that there are no questions about that. I hope that for everyone, everything was clear. I tried to be more clear that I can. I don't know, Andy, if someone could have other kind of questions just after the webinar, you can send to us and we will send them an answer. We could do it this way. Okay?
Sure. Thank you.
So I hope that everything was clear. Thank you to you, and see you soon.
Thank you, Dr. Ruggiero. Just, Hang, do you have anything to add on? Hang.
Thank Dr. Ruggiero. Thank you so much for helpful knowledge.
Vâng, xin cảm ơn bác sĩ rất là nhiều.
Nothing. Thank you to attend the workshop.
Dạ, em cảm ơn các anh chị ạ. Nếu các anh chị nào có bất kỳ câu hỏi nào nữa thì có thể gửi vào khung chat. Có thêm một câu hỏi nữa. Bạn Oanh ơi, bạn Oanh có thể dịch câu hỏi này cho bác sĩ để bác sĩ có thể giải đáp liền ạ.
Okay. They are starting to make other questions. So the question is, can we combine body filler with biostimulation substances like hydroxyapatite, calcium hydroxyapatite, for example? No, or better, I don't suggest to combine the both products in the same vial. This is what I don't suggest to do. But you can imagine to treat the patient with the two different products. For example, Prometalian has another product that is called Rich PL. It's a polylactic acid, and we started with the combined procedure with the upper part with the hyaluronic acid and the lower part where I said that you have not to inject with the hyaluronic acid, that could be injected with polylactic acid to restore the tightening of the tissues. So you could combine in the same session two different products, but not in the same layer, and especially not in the same area. So about the buttock, as I say, you have to imagine to treat the upper part with hyaluronic acid and the lower part, more superficial, with polylactic. I suggest to do that. We started to perform our treatment in this way with good results at the moment. Okta with the question. Made the question. So maybe there is another question that I didn't understand. Of course, because it's not English. About anatomy. Okay, so about anatomy. In these presentations, wait a second. Infatti abbiamo una presentazione originale di Perfect Line, la vecchia, ci sta l'anatomia e su questa non c'è. Okay. So, the layer of injection. Okay, starting with talking about that. we have different layers to inject the filler, not normally. Especially for the face, we imagine to treat our patient with higher concentration fillers for the lower layer, for the deeper layer, and less concentration hyaluronic acid fillers for the more superficial layer. Of course, the idea with the product that is macromolecular is to go deeper than you can. Normally, with other kind of products, so starting with this idea, other companies promotes their product imagining to treat the area, for example, especially for the buttock, with a lidocaine solution, so or anesthetic solution. Okay, so this idea to use the product, the lidocaine or the anesthetic solution for the entire area can reduce the appearance of the pain. Of course, this is important for the patient, but could be dangerous for us. You have to imagine that when you go through the muscle, so if you go too deep, too much deep, you go under the muscle and you can find two different or more than one big arteries, but also to try, or not only to try, but also you can broke some vein, for example. So you could have problems not only about the hematomas, but also about the injection inside the vessels. It's for this that I suggest in premise to not use the anesthetic solution for the entire area. So it's not suggested to use the plain solution in the entire area. And to be careful to remain above the muscle. So if you have the muscle here, you have to inject the product just on the muscle, but not go through the muscle. Because, as I say, to avoid vessels, to avoid the problem of the injections in the vessels, but also great problems of the hematomas, no? So I try to wait a second. Okay. I'm just looking if I find something about the anatomy. The oldest presentation had something about the anatomy, but normally I don't speak too much about that, just because you have to understand that the product has to be injected over the muscle. So I hope that Owen would be would be happy about this kind of answer. I don't know. Let me know. So, can you share the experiences with filler? Okay, another question. Can you share your experience with fillers for bilateral buttocks depression compared to injection to increase the curvature of the upper buttock area? Is there a large displacement ratio? So at the moment, there are a lot of differences between the patient's requests. Normally, the idea of our patient is to have a good projected buttock, well, just because we are talking about buttock, good projection buttock with no hip dips, so with no the depression, avoiding the depression, the lateral depressions, and to have a small waist. So I don't know if the Asian countries is more or less the same, but here in Europe and in USA, more or less, this is the trend at the moment. So the idea is to imagine a ratio that could be 1 to 1.6 at the moment. This is the idea. In my opinion, it's not easy to find, or better, would be interesting at the beginning, especially at the beginning, to share with your patients that not all people could have great results with this kind of procedure. So we can have good results for everything, but of course, if they are not able to spend the right amount for this kind of procedure, using less product, you can't have a great result. But especially for a patient like what I share with you, maybe here, I'm just looking for the image that I showed you before. Let me check 1 second. Here, for example. So I will share again my screen with you. So imagine on a patient like that, okay? She doesn't have great hip dips, for example, but she was, her answer was to improve the roundness of this area. So you have to imagine that if you do this kind of procedure, you have to start your treatment starting, as I said, on this kind of line. So this is the line where you have to start. Why? To not feel too much the waist. I hope to answer in correct way to your question, because about the displacement ratio, maybe this is what confused me a little bit. So what do you want to understand? I mean, just that you can treat your patient using the product for the lateral part and the medial part. Maybe the idea of QOC was to understand how much product you have to use. Of course, is easier to see the result for the lateral area than in the central area. So with the same amount of product, you could see more result to improve the curvature of the lateral part than the volumizing effect, than the projection of the entire buttock. Maybe this was the question. Let me know if the answer is right, if I answer in the correct way to your answer, to your question, sorry. Io ce l'ho sul mio computer, però... Ok, great. Thank you, Walk. And don't know. Other questions? The last question. Generally, it depends. Okay, the question is, can you share the care regimen for the injection area after bud filler injection? So, for example, how to avoid, how to do. Normally, it depends. If I perform this kind of treatment in my clinic, and I know that in my clinic I am not sterile, but really, really clean when I do that, I don't recommend any antibiotic product, any antibiotic to be eaten by my patients because it doesn't need. But if you understand that your procedure is not really clean because of I don't know something that goes wrong, I suggest to you to apply, not to apply, but to prescribe to your patient some antibiotic. Apart of that, I suggest to my patient to avoid the sport for 1 week, at least 1 week, and of course to be, for example, sometimes it happens that some patients do the procedure and after have to come back at home. That could be also not really near. So I suggest to them to be not alone when they perform this procedure, just because for them, it would be better to not stay seated for more than 3 hours, for example. So also at work, I say, okay, just for 3 or 4 days, avoid to be seated for more than 2 or 3 hours, and going around, try to go around for your apartment or for your working place to avoid that the product will be spreaded in other areas. But after 2 or 3 days, this problem couldn't appear. So normally, when you suggest that, you will be, or also to avoid, of course, some exposure to swim and something, also to avoid the infection, for example. Other problem, the patient couldn't have other kind of problems. So to not sit, yes, but sometimes it's impossible to recommend to your patient to not sit. So for that, you have to understand, and you say, okay, better if someone come with you and drive for you, you could say, for example, in your car, also not only seated, a little bit more with the seat going a little bit back, and if possible to do. Of course, if the patient say, I don't have anyone that comes with me to perform this procedure, to accompany me, it's okay also to drive, but the suggestion is to avoid to be seated in the same place for more than 2 hours, 2-3 hours. Nothing more. So remember, to not be seated for more than 3 hours. If the procedure is not clean and you understand that you have made something wrong, recommend the antibiotics and to avoid the sport at least for 1 week, nothing more. Of course, for the entry point, you will have an hole for the patient. As could be necessary to take it clean, so to take care of the entry point. Sometimes it could be enough also to apply one plaster, nothing more. Great. Thank you, Kwok, for the question. I hope to see you soon. Okay. Great. If there are not other kind of questions, you could send your questions to Andy, and then they send me, or better, you can send me the questions through Andy work. So I will send you the question, the answers through the Andy channel. Okay, Andy, I think there are no other questions.
Okay. Yeah. So if there is no other questions, we will proceed to end the webinar. And also, if you guys have any other future questions in the future, please do not hesitate to let any of the Oscar Medical staff know so that they could direct the questions to us and that we can give you a proper answer for that. With that, Hang, can I actually end the webinar?
Okay, great.
Hang,
Yes, I'm here.
okay. With that, can we officially end the webinar?
Yeah, yes, let me finish the webinar.
Okay,
Yes.
sure. Thank
Thank you.
you.
Thank you so much your doctor, like sharing a lot of helpful knowledge.
Thank you. Thank you to you. And thank you to everyone who attended.
Dạ, cảm ơn anh chị. Nếu anh chị có bất kỳ câu hỏi nào nữa thì anh chị có thể gửi vào website fanpage của công ty bên em là SKINFILL Việt Nam, hoặc là anh chị có thể gửi tới thẳng trực tiếp cho các bạn nhân viên kinh doanh, các bạn đang chăm sóc mình ấy, thì có thể gửi câu hỏi trực tiếp cho các bạn và các bạn sẽ gửi thẳng trực tiếp cho bác sĩ và bác sĩ sẽ giải đáp và gửi phản hồi lại cho mình ạ. Và em cũng xin chân thành cảm ơn bác sĩ đã chia sẻ những cái kiến thức bổ ích, và cảm ơn các anh chị đã dành thời gian để tham gia buổi webinar ngày hôm nay. Hy vọng rằng những kiến thức chuyên sâu và các thông tin từ bác sĩ chia sẻ sẽ mang lại những giá trị hữu ích cho công việc và thực hành của quý vị. Và em cũng chia sẻ một chút lại là hiện tại bên công ty em đang có chương trình khuyến mãi mua 2 tặng 1 dành cho các sản phẩm SKINFILL Body và Perfect Light Volume, chỉ áp dụng duy nhất ngày hôm nay. Nếu quý vị chưa đăng ký thì hãy nhanh chóng tận dụng ưu đãi đặc biệt này ạ. Và để không bỏ lỡ những thông tin quan trọng và các khóa học đào tạo chuyên sâu từ SKINFILL thì các anh chị hãy tham gia ngay nhóm Zalo của bên công ty chúng em. Tất cả các thông tin sẽ được cập nhật mới nhất về sản phẩm và các chương trình đào tạo sẽ được gửi qua cái nhóm Zalo. Và lời mời tham gia nhóm Zalo thì em sẽ gửi trên mục trò chuyện nha, cho các anh chị xem ha. Để em một chút ạ. Dạ, em vừa mới gửi lên trong phần trò chuyện là lời mời tham gia nhóm Zalo để cập nhật các thông tin sản phẩm và các khóa học đào tạo sắp tới của SKINFILL, và cũng như từ công ty chúng em thì em xin mời các anh chị vào bằng cái đường link đó để tham gia nhóm Zalo ạ. Và một lần nữa em xin cảm ơn các anh chị đã đồng hành cùng chúng em. Chúc các anh chị sức khỏe và thành công trong công việc. Hẹn gặp lại các anh chị trong các chương trình của webinar và các buổi học lần sau ạ. Xin chân thành cảm ơn.
The recording has stopped.